Andrew, first of all, you've got some developments on the school issue. What information do you have?
I do, Kieran. So I had some sort of anecdotal stories I'd heard that a lot of kids were still going to schools in New South Wales, even though the Premier encouraged people not to send their children. But what I've been told is that today in public schools in New South Wales, government sources have said to me, 10% of children went to school, 90% stayed home. Effective school closures. My wife's one of the people today doing homeschooling. She's certainly looking forward to an online package coming out to her. She's done her own form today. That's what parents are grappling with at the moment, Kieran.
Let's look at some other matters. The National Cabinet meets tonight, and we spoke to Josh Frydenberg about some of the things that they might talk about in terms of rent assistance and so on, and he's indicating that that is very much where they're heading with the support of the banks.
Yes, and what will this mean? I mean, will people still have to pay rent, or are they basically going to say you don't have to pay rent anymore, or how do you actually prove that you've come out of work or you're in distress and your landlord has to give you a break? All that surely has to be worked out, and very complicated, and could have deep consequences really for the economy. He's very lukewarm, the Treasurer, on this wage guarantee that we've seen Britain, Denmark and other European countries implement, a basic income to try and keep people in jobs. Down the track, we'll look back on that decision with interest, and I'm definitely assured there'll be a third economic package from government. So let's see if anything along those lines is considered. I would hope that Treasury is at least modelling it, having a look at how it might cost. They've got to look at every possibility. Let's have a listen to what Josh Frydenberg said about that sort of policy.
Well, we had a look at the UK experience, and the UK were very clear that they were making a new program here. We've sought to use our existing tax and transfer system, and it's not been Treasury's advice to adopt the UK model.
The Treasurer speaking to us early on the program. The other thing, obviously, that the National Cabinet will be focusing on as they have every meeting, but again, front and centre, is just how to provide the medical support when it's going to be needed, particularly ventilators.
Yes, ventilators and ICU beds. And as I revealed last hour, a briefing of New South Wales Cabinet yesterday had that there are every person getting infected is then infecting within that day 2.86 people, which indicates we could have as many cases in New South Wales as 25,000 in a month's time. So you can see the requirements from the ICU beds. The ministers were told that that would mean that there are 700 intensive care beds in New South Wales, 500 extra being stood up. If it is 20% of the population, 10,000, worst case 10,000 ICU beds you need. If at the worst case scenario of 60%, 30,000, you can see why all these venues are shut. Shutdowns are happening. I'm told there are plans to use hotels as hospitals. There's plans to use private hospitals as public hospitals. It's going to be hard if you're in hospital for anything else, and the direction this is going. Yesterday, as we said, there was still a big increase in cases in New South Wales and Victoria, but not as big a percentage increase, slightly bigger percentage increase than the day before. So the hope is with the closure of the pubs, etc., Kieran, that the curve is slowly going to go a bit more like that.
So, yeah.
And so let's all pray for that, really. But that's why even further measures are being considered. Now, they won't tell us, we've had stage one, they won't tell us what stage two is. I think they're still working it out, frankly, the medical officers. But, you know, I mean, you could speculate on schools definitely being closed, universities, public transport. That's been speculated to me around the last week or so. Let's hear what Greg Hunt said to me about shutdowns earlier.
Is it inevitable that more businesses will have to temporarily shut down and that there will, in effect, be a lockdown in this country, like in Britain, where people are basically ordered to stay at home except for essential services?
Sure. So I won't preempt, and I'm not for any other reason that I think it's entirely appropriate that the health professionals, because they have guided our actions, which have meant that we have been able to prevent the onset and the spread in Australia far longer than many others, that I will allow them to do their work. We have always indicated, as the Prime Minister said and the National Cabinet said, that this was stage one. It is not the last stage.
What could stage two potentially involve, and is lockdown later than stage two?
So stage two, I will respectfully leave that to the medical expert panel which is working on that. But there are a series of gradations here, which is about progressive social isolation, where we believe that is required. But above all else, people don't need to wait.
Andrew, now on another matter, you asked Greg Hunt about the possibility of some of the drug breakthroughs, and here we're not talking about vaccines, we're talking about treatments. As one researcher said, a potential cure for coronavirus. When people have it, it can kill this virus potentially.
We're hoping on this one, and you could tell by Greg Hunt's language that he's hoping as well. Just wanted to mention something else too. I had a tweet from a viewer from New Zealand, Dean Lester, who's pointed out that there's no one in ICU in New Zealand, no deaths, and yet they're locking down now. We've been pretty much lockstep on a couple of measures with New Zealand on shutting the borders, etc. So be interested to see if that comes into any consideration of the medical officers and the National Cabinet. But let's hear about some hope here in terms of a potential antiviral drug which could help, as Kieran said, wipe out the symptoms. And the Health Minister's sort of hope on this one, he really has some hope. Let's have a listen.
We have joined with the Queensland Government in supporting that. In addition, there have been philanthropic contributions. They are doing a wide expansion of the clinical trial, and there's both an HIV drug and a hexachloroquine, which is being considered as part of it. Then there are new proposals which have come to us today, which have been brought forward by the Walter and Eliza Hall Institute, one of the great medical research institutes, not just in Australia but in the world, a storied home of Nobel laureates. And that institute is looking at the potential for prophylaxis or preventive deployment. And we are considering that immediately, and I am hopeful that within the next 48 hours that they will have provided a strong case, but I am very predisposed to accept that.
That's the Health Minister. With a bit of the positive side to this is that there aren't many, but where there are breakthroughs, where there's progress, we need to remind our viewers of that, like you did there with your discussion with the Minister. And let's hope that not just the Eliza Hall Institute in Melbourne, but also the UQ progress, that somewhere along the line we see a definitive step forward on that. And Clive Palmer has donated tens of millions to this. He's going to be joining me in an hour to discuss his efforts with UQ. The other thing I want to talk about with you this hour is the leadership from the various levels of government, and certainly Gladys Berejiklian was out this morning saying she's not backing away one bit from her approach and stepping things up.
It sounded like the language of her and the Victorian Health Minister are more towards that shutdown situation. Let's have a listen to what they both said today.
We can tell from our numbers, and they're going up quite significantly every day, but many countries did not take some of the actions this early on in the process in order to control the spread. And I don't want to be another example of a jurisdiction that didn't do what it needed to do at the right time.
We are looking at many thousands of lives lost. I'm not saying that to scare the community. This is modelling, but modelling is projections. It is no set destiny here. It is in all of our hands. We can all work together to reduce the number of deaths.
And just finally, we heard Andrea Crothers reporting about the dramas at Centrelink, the dramas on the Centrelink website. You've got to have sympathy for those who are working there, for the ministers, the PM, the Premier, but I think what a lot of Australians would like, if there's a stuff-up, at least own it.
Yeah, it has to be done, because this is a time we actually have to trust the politicians. And actually just sitting here thinking about that in the context of Stuart Robert and us talking and slamming him really for a very poor mistake in suggesting that it was a hack of the system when it was just the system overloaded. What else is he getting wrong as a minister? I mean, he should apologise. But it does sort of point to something very unique here, Kieran. As Australians, we don't tend to trust politicians. This crisis means we're going to have to. And that's a lot of responsibility for them, and I know there's a lot of pressure on them. But they really have to step up here.
Yeah. Well, and that sort of behaviour does let down the rest of his cabinet colleagues as they're trying to, and it's a tough job the PM and the Treasurer have got, and they are trying to just reassure people. So factual information is crucial. Andrew, thanks as always. I appreciate that. Let's